a safe and surefire way of smoothing out fine lines and wrinkles, or a toxin that permanently leaves your face in a frozen expression. Either way, Botox is big business. I am Dr Sophie, I'm a GP, but you may not know I'm also a medical aesthetics doctor. So I'm going to tell you all about Botox. What are the good things about it? What are the bad things about it? What are the risks? What are the myths? And keep watching, because you'll also find out whether I, with all this knowledge that I have, and at the age of 44, get Botox myself. What do you think? Is this a face of a frozen Botox person or not? Stay tuned and you'll find out. Botox is actually a brand name for botulinum neurotoxin. So you can see why we all just essentially say Botox. Botox was just the first one to be FDA approved. I actually use a different brand. I use one called Botox. But I'm going to continue calling it Botox for the purposes of this. So it's actually the most common cosmetic procedure worldwide, with about 3 million injections every year. So Botox works by stopping your nerves from releasing some brain chemicals called neurotransmitters that cause the muscles to contract, so kind of tighten up. So because they can't contract, then they relax. And by relaxing, you get less visible lines and wrinkles. It's actually been used since the 1980s for medical conditions, starting with things around the eyes, but we also use it for things like headaches, bladder problems, oversweating. And it wasn't until 2002 that the FDA approved it for its current cosmetic use. Okay, so what are the pros of Botox? Well, obviously you get smoother skin, less lines and wrinkles. We all want to look a bit younger for longer. People are even using it now as a preventative treatment. So even people as young as in their 20s, apparently some of the Kardashians might be doing this, getting what's called baby Botox. So you get small amounts of Botox to prevent wrinkles from even starting. Because once you are getting Botox, obviously for that period of time that your muscles are paralyzed, you're not getting any worse wrinkles. But Botox is only good really for the dynamic wrinkles. They're the wrinkles that appear as you move and smile. So as you get older and you get what we call static wrinkles that are there all the time, Botox is less good at getting rid of those. A really interesting study looked at a pair of identical twins, one of whom had been getting regular Botox injections for about 12 years and the other hadn't. In fact, she just had it done twice. But even after 7 months since the last injection, the one who'd been getting the regular Botox injections still looked a lot younger and had less crow's feet, all these little lines here, showing that it does actually prevent the wrinkles. And then there's also something really interesting, whether or not Botox can help as being an antidepressant. So studies are ongoing with this, but the theory is when you have Botox here to your frown lines and you can't frown, then it links to your amygdala, which is like your emotion center, and it kind of settles down your feelings of anger and fear, so you feel a bit more calm. And also you might have better social interactions, because even if however angry you are with your partner or whoever, when you're trying to be cross, you can't frown. So they think, oh, she's happy, she's fine. And then you end up not really having that argument you were going to have. So anyway, the theory is, but it is interesting that maybe it can be used as an antidepressant as well. Okay, so what about any potential long-term side effects? Well, some people worry that it can cause what we call muscle atrophy over time, which essentially means like thinning the muscles. We're not sure about this. Don't really worry too much, but if you have been having very regular Botox for a long time, it may sometimes be a good idea to have a little break to let your muscles relax. All right, what about the downsides of Botox? Well, one of the major downsides is the cost, because if you are having it done every 3 months, it can get pretty expensive. In the US, it's usually about over $500 apparently. In the UK, it's around about 150 to 350 pounds. So it's a huge expense, often cost prohibitive. All right, let's do some myth busting. So, is Botox rat poison? No, it's not. In fact, it's very safe as long as it is carried out by a trained medical professional. So make sure you know who's doing it and they've got the right qualifications. People also believe that once you start Botox, you can't stop. That's not true. Stop whenever you want. Your face will just go back to normal. People also believe it's just for women, but actually so-called Botox is really on the rise, because men are also realizing they also want to look better for longer. People also worry that Botox is addictive. Well, there is no chemical addiction, but sometimes people do become addicted only in the sense of they want to feel and look that good like they did last time. Lots of my clients have the same questions when they first get Botox, so I will answer them now for you. Are you ready? Does it freeze your face? Not if it's done well. A good practitioner can soften the lines and wrinkles and still leave you room to move. Does it hurt? It is an injection into the skin, so it does leave a little sting. How long does it last? It usually lasts about 3 to 4 months, but if you have it done regularly, you might find that you don't need it done quite as often. How quickly does it set in? It usually starts to kick in after about 3 or 4 days. You might be there in the mirror kind of trying to frown. But its full use will be after about 2 weeks. What if I don't like the results? Don't worry too much because Botox is temporary. So if you don't like the results, they will wear off. Can I go back to work straight after? Yes, you can. Lots of people get it done in their lunch break. You must make sure that you have had a proper consultation and you feel confident with the practitioner. But in terms of how quickly it settles, it's very quick. What's the difference between Botox and fillers? So Botox relaxes the muscles to help with lines and wrinkles, whilst filler, like to cheeks and lips, adds volume. So in conclusion, is it right for you? Well, there is a bit of a debate about whether or not you kind of should just embrace the journey of aging and age naturally, or whether you want to make enhancements to yourself in any way you want to. And really, it is completely personal, and there are pros and cons. And so just with all this information, decide what's best for you. Now, I was gonna tell you right at the end whether or not I get Botox. Have you guessed? Well, I was a medical practitioner doing aesthetics for years and years and years before I did get Botox. Eventually I tried it and I do love it. So yes, I do. I do get essentially baby Botox. So I get small amounts of Botox because I still want to make sure I can have plenty of expression in my face. But I do find it helps kind of lift my eyes. I've got slightly hooded eyes and it generally does make me feel kind of a bit better. So yes, I am a fan of Botox. So a thumbs up from me. Hope you like this video. If you want to find out anything more that I talk about on my Dr. Sophie Lifestyle channel, that includes things like whether or not you should bother with collagen supplements, then do take a look at my other videos. And I've also got my Dr. Sophie GP channel for anything that you might want to speak to your GP about. Thanks for watching. Bye.